Hello, everyone, and I'm going to let people come in to the room here for a second. I'm Dr. Angela Fitch. I'm the co-founder and chief medical officer of KnownWell, and thank you so much for joining us a little bit earlier today. I apologize to all of you who may be watching the recording because we did have to change the time last minute because of a conflict that I had. So I apologize for that. I recognize your time is very valuable. So thank you so much for those of you that got the memo and are here a little bit early. For those that didn't get the memo, unfortunately, and might be looking for this at 6 o'clock, please know that I apologize, and we'll certainly have this posted for you to be able to watch it. We'll send it out to everybody as well, in case you missed part of it or need to go. So again, as I mentioned, I'm Dr. Angela Fitch. I'm the co-founder and chief medical officer of KnownWell, and happy to be coming to you live tonight from Boston, Massachusetts, where it's a lovely sunny day. So hopefully you're out on a walk, enjoying the weather. Hopefully it's nice where you are, and you're listening to this, as you're cruising along. If you are in a place where you can ask a question, you're certainly welcome to put questions in the chat in the Q&A. Sorry, there's a Q&A button. If you go into that Q&A button, put questions in that Q&A button, I can answer those questions for you at the end. So tonight is our In the Know, our April In the Know, and it's not an April Fool's joke. And we are here to talk about Foundayo. That's orforglipron. It's here. It's understanding what it means for your health journey. So Foundayo is a new medication we have on the market that was approved on April 1st. Again, not an April Fool's joke. So we're here to talk about what that means for everybody. So let's jump in, get started. All right, so we'll talk about what is Foundayo. It's a new pill for chronic weight management. We'll talk about a little bit how it works and what the side effects might be and the outcomes, what you can expect if you did decide to use medication in your health and weight management journey. We'll talk about some options if you don't have insurance coverage, like the cost of the medication if you don't have coverage, and then how we can help at KnownWell. If you're new to KnownWell, then give you some information on that. If you're one of our established patients, we're glad you're here, and good to see you tonight. I always like to start off these In the Know with a discussion around why lifestyle alone is often not enough for treatment of weight management issues. Because weight loss itself is not normal. Weight loss is abnormal. It's abnormal to lose weight. If you look at this tug of war here, as people reduce their calories and increase their physical activity to potentially, change the level of body fat that they have on their body, change their body size, unfortunately, our body fights back on the other side. It slows down our metabolism, it increases our hunger hormones, and it decreases our fullness hormones. So if you see that tug of war, right, that weight gain side is winning. And that was designed intentionally for us to not evolve off the face of the earth, right? That was something designed for us to be able to maintain our weight long term in the sense of maintaining that weight gain, right? Losing weight is not normal. So that's why oftentimes we need something like a medication or a procedure or even surgery in order to fight back, to add pull on that tug of war in order to maintain that weight loss long term. So there are several of these nutrient stimulating hormones. So you will recognize in this diagram here at the bottom here, GLP-1. So GLP-1 is probably, a recognized term now in society. It's been around these medications have been around for 20 years, and it's been around in our own human body for ever since we evolved, right? So again, all these nutrient stimulating hormones are important. Essentially, our weight is very finely tuned and managed via an area of our brain called the hypothalamus. And that interaction, you see here, all these lines are the interaction between the brain, between the stomach, between the gut, between the intestine, between the pancreas, and even the adipose tissue itself releases these nutrient stimulating hormones that affect your hunger, affect your metabolism, affect your meal timing, your meal size, your energy expenditure, right? And I put this here just to show that we have GLP-1, we have these medications that are GLP-1 agonists, so they activate the GLP-1 receptor. We have GIP now, our medication Mounjaro or Zepbound, which is tirzepatide for weight management, is a combination. It activates both GLP-1 and GIP. And I put some of these others here because in the future, we're going to have other medications that are going to do things like activate amylin, for example, or activate oxyntomodulin, which is this OXM. So there are other medications coming down the pike that are activating these hormones that then help us to regulate our metabolism. So this is how the whole thing works, sort of in a nutshell. If we look at that a little deeper, on the left-hand side here of this diagram, you have GLP-1 like receptor agonism. So activating the GLP-1 receptor causes all these things to happen, causes decreased food intake. Unfortunately, it causes a little bit of nausea, right? That's one of the side effects of these medications, or the side effect of activating that receptor. And then we have satiety, which means we feel full. We have changes in our insulin and our glucagon, which are our hormones in our body that also regulate our metabolism. We have a decrease in our gastric emptying. Our stomach doesn't empty longer and you feel fuller sooner, right? That is the one of the mechanisms of action of this GLP-1 receptor activation. We also have on this other side glucose-dependent insulinotropic polypeptide receptor agonism, or that's in short what we call GIP. So when we activate that GIP receptor, such as in the medication Mounjaro or Zepbound, we get also decreased food intake. So you get double of that, right? That's why one of the reasons that the medication Mounjaro or Zepbound is more effective than some of our other medications. And you also get a decrease in nausea, which is also why, for example, with that medication with tirzepatide, Zepbound or Mounjaro, you can have some offset of that nausea caused by the GLP-1 activation. So why some of the side effects are a little bit different with these medications. So that's mainly what I wanted to show with this diagram is what happens in the human body relative to the activation of these receptors is what we're doing to manipulate, and to cause changes in our metabolism, changes in our body that promote fat loss, right? As the goal, right? Because excess adiposity can lead to inflammation, can lead to other diseases as it relates to, our health and well-being long term. And so what is Foundayo? So Foundayo is a once daily pill for weight management. It is a GLP-1 receptor agonist. So it activates that GLP-1 receptor. It is not oral tirzepatide. It is made by the same company, Eli Lilly, that makes tirzepatide, but many patients think that it's an oral version of tirzepatide. That's not the case. It's a brand new medication. It's a medication that activates that GLP-1 receptor, and it's in that same class then as Wegovy or Ozempic, that same type of GLP-1 only activation, right? It's activating that one receptor. Although in this case, it's in a convenient once daily tablet and was FDA approved on April 1st. It is what we call a small molecule medication versus a peptide. So it's not this long peptide. Peptides like Wegovy, Ozempic, tirzepatide are different amino acids that are being put together into a peptide, which is a protein molecule. And so that protein molecule is very hard to get into our bodies, which is why these medications have to be an injection, or in the case of Wegovy, why they have a special absorption of the Wegovy in order to get it into our system, because it's hard to get these big, large molecules, these big, large proteins into our body. But Foundayo is not a large protein. Foundayo is what we call a small molecule medication because it activates that GLP-1 receptor a bit differently than a protein molecule does, right? So it works a little bit differently, but it accomplishes the same goal in the end, which is to activate that GLP-1 receptor. Because of that, right? Because it's a small molecule and not a peptide, that means it's not an injection. There's no restriction around food or water. So because of it doesn't have to have special environment in the stomach in order to get absorbed, it is able to get absorbed even if you're taking it with food or something else, drinking it with your coffee or whatever you want to take your medication with. There's also no refrigeration needed of this because it is, again, a true sort of drug, right? It's a small molecule type of drug, not actually a peptide or a protein. The dosing schedule is listed here. So it starts at 0.8 milligrams once a day. You take this pill once a day again, and then we can increase that every month or every 30 days, every 4 weeks, as tolerated to get to the top dose. So you see there are 1, 2, 3, 4, 5, 6 doses total to get to that top dose. And that top dose, 17.2 milligrams, is where the data that I'm going to show you as far as weight loss goes, is coming from, right? It's assuming that people get to that top dose. That's the most effective dose as it relates to weight management. And so you might be asking yourself, this is, there's a picture of the starting dose. All the doses, you can see the pictures on the Lilly Direct website. There are different colors for each dose tablet, so you can tell the difference. And they come, in that bottle shown there. And so in the randomized controlled trial that was done in order to approve Foundayo for by the FDA, that was called the ATTAIN trial. So any of the ATTAIN trials are going to be trials of Foundayo, using Foundayo as a medication. And so it went for 72 weeks, which is about a year and a half, right? 3,127 patients, and they did not have diabetes. So these are not patients with diabetes. These are only patients with obesity or overweight with a comorbidity. So they had a BMI greater than 27 with some sort of other health condition affecting their body, or they had a BMI greater than 30, and those patients entered the clinical trial. Also, they were aged 18 and over. This medication is currently only approved for people 18 years of age and older. And you can see here the average body weight reduction versus placebo. So in the placebo arm, people lost 0.9% of their weight. They lost close to 1% of weight. People in placebo controlled trials lose weight because they're also getting lifestyle intervention. Everyone is getting lifestyle intervention. Most patients are coming in once a week initially. They're talking to us. We do clinical trials at KnownWell. We did not participate in the clinical trial for Foundayo, but we do clinical trials on some of these new medications, in our clinics. And, patients come in weekly. We give them counseling around diet and exercise, around sleep, around stress reduction, all the important things to consider as it relates to our lifestyle. And you can see here that in the 5.5 milligram dose, so that is more, that's only 3 doses up, right, into the pathway. So they started at 0.8, then they went to 2.5, then they went to the 5.5 dose. And those patients and then they stayed on that 5.5 dose for the whole year and a half. Okay, so they stayed that whole time on that 5.5. So each of these arms of the study, the 5.5, the 9, and the 17.2, the patients were taken up gradually, like I showed, to those doses, and then they were maintained on those doses for the whole year and a half. So if you stayed on 5.5, if you only went up to 5.5 and you stayed on that for a year and a half, you'd be expected to lose about 7.4% of your body weight, which in these patients, which were around 235 pounds to start with, that was about 17 pounds that those patients lost. In the 9 milligram group, so they went up 2 more doses, right, into the 9 milligram, 1 more dose, sorry, into the 9 milligram group. Those patients lost 8.3% of their body weight, which is about 18.9 pounds, so close to 19 pounds. And then for the patients that went all the way up through the 6 doses to the top dose, 17.2, so that took them 6 months to get up there, and then they stayed there for the rest of the year and a half time period, they lost 11.1%, which is close to 25 pounds. If you look at also patients who lost greater than 10% of their weight, if we just look at the patients in that 17.2 milligram arm, so those patients that went to the highest dose, over half of them lost at least 10% of their starting weight. So 54% of them lost at least 10% of their weight. 36% of them lost 15%, so more than average, right? So the average was 11, but 36 for them, close to 40% of people, were able to lose 15% of their starting weight. And then if you look even at 20% of their weight, close to 20% of people, 18% of people, were able to lose 20% of their weight. So they got even more response than the 11, right? If 11's average, you have some people that are above, and half the people are above that average, and half the people are below. And we don't know who, as a patient, is going to be above the line or below the line. That's really a try it and see how you do type of option. That's what research is really focusing on today, is how do we find out as patients, right? We want to know, am I going to be a high responder or a lower responder? That's not your fault. That's because that's just the response of the medication to your body, how the medication is working with your body. So Foundayo is also showed improvement in important health markers. So it's not approved for this, it's approved for weight management. But beyond the scale, Foundayo showed improvement in lowering blood pressure, reducing your triglycerides, which are the pure fats in your blood. They improved cholesterol parameters, lowered LDL cholesterol, the bad cholesterol, and raised HDL cholesterol, reduced waist circumference. So your waist got smaller, which means your belt is fitting better. Or patients tell us all the time, well, I now can feel more comfortable in my clothing, or I can ride in the airplane without the seatbelt extender. These are the non-scale victories that we talk about because that makes a big difference as far as people's as far as living your life, right? That's what we really want to focus on is doing things for the health of it, not the weight of it, right? I'd say that all the time in clinic. We do not want to be lighter. We want to be leaner, right? So we don't want to focus on a certain number on the scale, but we want to get strong so that we can actually, continue to get up out of this chair and walk across the room when I'm 90 years old. So I want to be strong and lean, not necessarily just light, like a number on the, focusing on a number. They also showed in the clinical trial 47% reduction in the inflammation marker, which is called high sensitivity CRP. So we often will measure high sensitivity CRP in these trials. And on that 17.2 milligram dose, people had close to a 50% reduction in that CRP, showing that there's a reduction in inflammation of the body. And then as we look at reduced also patients 91% of patients, sorry, with prediabetes at baseline achieved near normal blood sugar at 72 weeks versus 42% of placebo. So if you have prediabetes and you are looking to get rid of that, right, 91% of people at the end of the 72 weeks did not have that prediabetes anymore. So it's also having effects on our blood sugar. If we look at weight loss responder rates across all the trials, so semaglutide, tirzepatide, and also now orforglipron. So I've added the orforglipron here to this table, and you see here we have oral semaglutide, which is oral Wegovy. We have injectable semaglutide or injectable Wegovy. We have injectable tirzepatide, which is a once a week injection at the 5 milligram dose. And then we have injectables tirzepatide at the 15 milligram dose, which is our most effective treatment that we have today on the market. So if you look at this is how many people are losing 5, 10, 15, or 20% of their weight. So going back to that sort of what we call categorical weight loss, because as a patient, like I said, we're not average. We're not an average number. And if you have a goal, because let's say you want to reduce your inflammation, we know that a lot of people feel better, they move better, their knees don't hurt as bad, even when they lose 5 to 10% of their weight. So the question is, what are my chances of doing that if I add this medication to my lifestyle intervention? And for orforglipron, for 5% weight loss, 77% of people are able to do that. You see, that's pretty consistent. These numbers are pretty much the same. You can see them getting a little higher. 86% of people with injectable semaglutide or injectable Wegovy, close to 90% with tirzepatide, and 96% with the highest dose. So again, there's more people reaching that weight loss goal. But again, there's still 77% of people that were able to achieve that goal, even with the orforglipron. So this is just to show that the difference in the amount of people able to get into that category of weight loss with the different treatments. Because it says, for example, if you need to lose 15% of your body weight because maybe you need to have a knee replacement, and the orthopedic surgeon has said, I would like you to have this amount of weight loss. I want you to weigh this amount, before you have surgery for your safety and for the efficacy of the surgery and all the other things that go along with it. If you need to lose 15% of your weight loss, you have about a 40% chance of doing that if you take orforglipron. You have a 50% chance if you go into the Wegovy type category, and close to a 60 to 80% chance with tirzepatide. So it doesn't mean that, that one is sort of better than the other, but it just increases your odds of reaching that goal. And that's what you have to kind of balance, right, as it relates to what is my goal for weight loss? What am I willing to maybe even unfortunately spend because of cost of these medications and coverage, and also side effects, right? Or maybe you don't want to take an injection and you want to see if you're one of the 20% of people that's able to get 20% weight loss with an oral pill that you take once a day. That's perfectly acceptable because 20% of people are going to be able to do that with this treatment. So there's some important medication interactions. Oh, wait, I missed one slide. I went past one because I thought it was, oh no, that's the one. Sorry. All right. So there's some important medication interactions to talk about with Foundayo in particular. So you have to, if you're taking another medication which inhibits this enzyme in your liver, right? If you have another medication, these are some examples of those medications are listed here: clarithromycin, itraconazole. Clarithromycin is antibiotic. You have an antifungal. You have some HIV medications that are very, important, right? Because people are taking those medications. You have some blood pressure medicines there. If you're taking one of those, it can actually raise the orforglipron level significantly in your body if you're taking those two together. And so we have to cap the dose at 9 milligrams again. But that doesn't mean you're going to lose less weight. It means that at 9 milligrams, you're going to have more level in your body. So we keep it down low because you may be taking one of these other medications. So there are more medication interactions, unfortunately, with Foundayo, this small molecule GLP-1 class, than there are with the other GLP-1s and the injections. Those have not less side effects, but those have less medication interactions. With the standard GLP-1 and GIP injections, they don't have as many of these medication interactions. Also, if you are taking an inducer of this enzyme. So that means if you're taking a medication that upregulates this enzyme in your body, then that can reduce the levels of the orforglipron in your body and make it ineffective. So again, we don't want to give you something ineffective. So if you're taking a medication that's listed there, for example, for HIV, you probably wouldn't want to take this drug. You'd probably want to take tirzepatide or one of the other medications that doesn't have that interaction. So just important to consider that this type of medication, these small molecule GLP-1 drugs, have more of a interaction with some medications that people might be taking. Also point out it's important to discuss supplements with your clinician. This is why it's also important to get these type of medication treatments, from a clinic such as we have at KnownWell, where people are really taking a comprehensive look at you holistically as a person and not just filling out a form on the internet and getting a prescription in the mail. Because again, we want to look at all of these issues so that we don't have a problem. And St. John's wort, for example, that some people take for mood or for sleep or for anxiety, for feeling better, can interact as well. So again, something we would want to then potentially stop that St. John's wort so that you could take this medication. So important to talk to your clinician about supplements all the time, because a lot of supplements people don't realize interact with medications, and you need to be careful about that. Also, simvastatin. Simvastatin is a cholesterol medication and is a statin drug. And if you use the two together, it can lead to significant increases in the active metabolite of simvastatin. And so, again, the recommendation is then to not exceed 20 milligrams of simvastatin once daily when people are taking Foundayo. So if you need to take simvastatin, it's very rare. Usually people can change to a different statin. So rosuvastatin or atorvastatin, those are safe with Foundayo. So it's just the simvastatin in particular that has this interaction. And so we wouldn't want to exceed 20 milligrams of the simvastatin. So again, important considerations that we take into account as clinicians when we're looking at how to help patients, reach their goals effectively and safely. And then this was the slide I thought I passed up, but I didn't. So this is comparing the GI side effects of the different medications, because people ask all the time, well, what about the Wegovy pill versus Foundayo? Or what about if I'm doing Wegovy injection or Zepbound injection? And I've included in here in the purple some of the placebo data, because you notice that close to 20% of people in both of these trials, 20% of the placebo patients reported nausea. They were on a placebo. They were taking that just goes to show you that nausea happens to us as humans, even if we're not taking an active medication. So again, just something to consider, that there's 20% of people that are reporting nausea, even when they are on a saline injection or a sugar pill, right? Essentially a pill that doesn't contain any active ingredient. But you can see the difference with Foundayo here in the first column, having a little less side effects overall than some of our other medications. Pretty much equal as it relates to constipation, right? It's pretty much equal there. Diarrhea, again, pretty much equal. as far as a little bit lower on the higher dose of Zepbound, interestingly, but for the most part in that sort of 20 to 30 range across the board. And vomiting, like I said, maybe vomiting and nausea a little bit lower in that Foundayo group compared to some of the other medications that we have. But you see even, the Zepbound was at 28%, so a little bit lower too on nausea because it has that GIP in there, and we think that helps to mitigate some of that nausea. And importantly, too, I should say, we wouldn't want to take Foundayo with another of these medications. So we don't take two GLP-1 type of medications because Foundayo is a GLP-1 receptor agonist. So we don't pair that with other medications that are GLP-1 receptor agonists. So you wouldn't want to add the Foundayo, to your Zepbound or your Wegovy, et cetera. We want to switch them out if we're gonna do that, make that change. And so the average weight loss at 1 year for each of these medications, and in this case, I included the 5, 10, and 15 milligram of tirzepatide data. You can see again, you get the most weight loss on average. Again, some people are more, some people are less, but on average, you get about 50 pounds at the end of, this is actually a little longer than a year at the end of 72 weeks, but about 50 pounds of weight loss on the highest dose of tirzepatide, a little bit less on the 10 milligram, but about the same. And then you get about the same with injection or oral Wegovy in that sort of 33 to 35 pound range. And then in the Foundayo, you're getting 29, so close to 30. So there's not, there's a few pounds there, but pretty much we see some equivalency there of the 5 of tirzepatide, the injectable Wegovy, the oral Wegovy, and the Foundayo, right? So they're kind of all in that same category. And so some tips for, best results, right? Whenever we're working with patients with adding medication, to their healthy lifestyle goals, right? Is, we start low and we go slow, right? We follow up with you monthly for 6 months. That's our intention, at least. We know sometimes people miss appointments or something comes up, but monthly for 6 months so that we can really make sure that you're tolerating the medication and really dose that appropriately for you. And then, we adjust the dose given side effects or weight loss, or maybe you're not able to eat enough and get enough protein and get enough nutrition. We want to make sure people are getting enough nutrition. And our goal in general in weight management space is to help patients, with a 1/2 to 2 pounds a week at most of weight loss. It depends on how much weight you have to lose, right? It's really based on a percentage, not an absolute number. And we also oftentimes will consider prescribing medications for nausea or supplements, things like ginger or those pressure bands you can use those C bands you can use on your wrists. So lots of different treatment options as it relates to managing those side effects. The common side effects, as you can see, were nausea, vomiting, diarrhea, constipation. These abdominal type of side effects of all of these medications, they typically improve with time. Often patients also might complain of indigestion, burping, bloating, heartburn, gas. Again, we can use some other over-the-counter medications even to help with that quite often. And also our dietitians counseling people on certain foods that they eat can be very helpful in terms of managing a lot of these side effects. Headache, fatigue, hair thinning, that also can be seen even just with weight loss, right? If you're not consuming enough calories, if you're losing weight, you can have some of these side effects even just from the weight loss itself. So some of those side effects come from the weight loss and not necessarily from the medication itself as a drug. And then it's important to note for women of childbearing age that if you're on oral birth control, the efficacy may be reduced during titration. So use a backup method or an alternative, like get an IUD that's not affected at all. Or, if you're doing an oral contraceptive, we want to make sure that you're using some sort of other form of contraception at the same time to avoid an unintended pregnancy. Also, a lot of many women, may be struggling with PCOS, which also relates to insulin resistance and weight and other issues. And with that struggle, people don't have as regular periods, and we can see people's periods come back. So we don't want to rely on that PCOS as a method of birth control, so to speak, meaning many people are having, a hard time with PCOS getting pregnant, but we don't want that to be the birth control. We want to make sure people are on some sort of birth control so they don't have an accidental pregnancy. And so you might ask yourself, well, what about I want to switch, from one of the injections to Foundayo because, I'm somebody who likes to take a pill every day instead of an injection once a week. I'm kind of maybe you've been on these medications for a while and you're kind of tired of taking an injection and you want a oral pill option. Well, They have done a study, so it's called the Attain Maintain study. It hasn't been published yet, but we have early top line data, they call it, which is data that they extract from the study and then they release it. But in that study, it showed that patients who switched from Wegovy at 1.7 or 2.4 to Foundayo maintained virtually all of their prior weight loss. So the average weight regain was 2 pounds. Those patients regained 2 pounds over 52 weeks if they had lost weight with Wegovy and were now, down that 15% weight loss with Wegovy, right? And they, on average, maybe they were down a little more. But if they switched over to Foundayo and then for the next year, they were able to maintain that weight loss for the most part, they regained just 2 pounds. Patients who switched from Zepbound 10 or 15, because again, Zepbound 10 or 15, if you remember from that graph, are more effective, theoretically speaking, than the 2.4 or 1.7 of Wegovy, right? So with that more effective treatment, patients probably have lost more weight overall at their journey. So when they switch them to Foundayo, which is a bit less effective than the Zepbound, right, at that dose at least, those patients regained 11 pounds over 52 weeks. But that's important to know because while regaining 11 pounds might sound horrible to some people, if you lost 60 pounds and are still down 50 pounds, that might be something that you decide to tolerate if, again, you're looking at cost or you're looking at I don't want to take an injection all the time. I don't want to have to, travel with it, et cetera. I'd like to just take a pill, right? Maybe that's worth it to you. But that's what you should understand, right? As a patient, is what is and that's what we help you understand at KnownWell. Should I switch or not? And if the answer, if you're in your mind or if your goal is to really keep all that weight off, no matter what consequence, then you really shouldn't switch, right? Especially from Zepbound at 10 or 15. You should stay on that for maintenance in order to maintain that weight reduction over time, because you would be expected to regain some weight if you did switch to Foundayo. And that's kind of expected clinically because Foundayo is not quite as potent or it's not quite as effective in the beginning state, right? The average weight loss is not quite as high as that 10 and 15 Zepbound. All right. So what is the cash cost of treatment? Or if you're, don't have insurance coverage, right? How much does Foundayo cost? And so at the zero point 0.8 milligram starting dose, it is $149 a month. As we get up into the 2.5 milligram, that next dose, it's $199 a month. And then at the 5.5 milligram and above, it's $299 per month. On the higher doses, the 14.5 and the 17.2, you have to refill every 45 days to get the 299 price. You can get the Foundayo at a local pharmacy with a coupon. This is showing you the savings through Lilly Direct, or you can get a savings card from the Foundayo from the website here, and you can use that to get the Foundayo at a local pharmacy. But Lilly Direct, you don't need a coupon. We send that prescription to Lilly Direct. All of our clinicians can do that. We send that prescription right over to Lilly Direct. They text you, you get signed up. You can use your HSA card to buy the medication, and they just ship it to you in the mail. And it's really, quite speedy actually. If you look at that, at the highest dose, the 17.2 milligram dose, at the 299 price, it's about $10 a day, right? That you're spending on medication. And for many people, that might be completely not doable. But for some people, they recognize, I've had patients tell me even, well, I'm actually not going out to eat as much now, because I'm not as hungry. So I'm bringing my lunch. My lunch is a yogurt and some blueberries and a protein bar and I'm done, right? I don't need to go out to lunch. And so I'm saving that $10 a day because I'm not, going out and getting my lunch. I'm able to pack a smaller lunch and be satisfied. So again, there's many people have to level set this themselves, as to is that something they can afford, especially afford long term. And we recognize that that is a challenge. And we're working hard on that at the national level to try to work on, how can we get better universal coverage? We're marching on Capitol Hill all the time. And so please do that yourselves as well if you feel inclined to make sure that we get these types of treatments as a standard benefit on all insurance. That's my little plug. If you have insurance coverage for weight management medications, these are patients that If your employer has opted in, your employer is the one that decides. So not necessarily your insurer, not necessarily Blue Cross Blue Shield or somebody else, but your employer has to pay extra to the insurance company to say, hey, we're going to cover these types of medications, or has to pay extra for the medication for you. And in those cases, if you're commercially insured, that means, you have an employer and they cover medication, then you pay as low as $25 a month, for Foundayo, just like the other medications as well. That's the same price for those other medications. There is a coupon card that you get to buy down some of that copay if you have a higher copay. So some employers set a higher copay for these types of drugs. And then again, if you use this savings card that's available online, that can reduce the price for you to $25 a month. And hopefully in July of 2026, just a few short months, Medicare is going to cover these medications for weight management. So if you're a Medicare beneficiary and you're out there, listening tonight, know that starting hopefully in July, that's what we've been told at least, Medicare will cover these mostly all the medications for that matter, the weight management medications, Zepbound, Wegovy, Foundayo for the treatment of obesity in these special circumstances. So for Medicare, you do have to have a body mass index greater than or equal to 35 if you have no other comorbidity, no other health problems. So unfortunately, they're making it a little bit higher, BMI, for coverage in order to be able to afford to pay for all this. That's what the way Medicare is structuring it. If you have a body mass index greater than or equal to 30, plus you have one of these conditions, this is HFpEF is heart failure, uncontrolled hypertension, CKD is chronic kidney disease, 3A or more or worse, moderate obstructive sleep apnea, or metabolic associated steatohepatitis, or what we called fatty liver disease in the past. If you have one of these conditions and your BMI is greater than 30 and you're on Medicare, then you'll also get coverage. If your BMI is greater than or equal to 27 and you have prediabetes, so again, those people fall into those other categories too, right? If your BMI is greater than 30 and you have prediabetes, you also will have coverage, right? It does fall down, accordingly. So BMI greater than 27, any BMI greater than 27, plus prediabetes, have had a heart attack, a stroke, or have that metabolic associated steatohepatitis, or have symptomatic PAD stands for peripheral arterial disease. So blockages in the arteries of your legs. So if you have blockages in the arteries of your legs and you have MASH, this fatty liver disease, you've had a heart attack or stroke, or you have prediabetes and a BMI greater than 27, any BMI greater than 27, then you would be able to also get medication coverage. And so, at KnownWell, we don't just focus on medication. We really, like I said, really try to focus on health and doing things for the health of it. As I mentioned, not the weight of it. So we focus on not just medication, but also nutrition therapy with our wonderful dietitians, behavioral modification, focusing on physical activity, and then, of course, the medical interventions, also referring people for surgery if that's indicated, as well as there's other procedures one can do as well. We also look at complication management, right? Identifying, do you have sleep apnea? Do you have liver disease that we need to be concerned about? Watching your blood pressure, your cholesterol, your diabetes management. Plus, we factor in women's health issues, menopause. We know that's a big transition for women, and that's a time of increased fat gain, especially around our midsection for women, around our middle. And again, a health concern for women. And so that may include having hormone therapy in addition, to some sort of medication to manage weight, because we do have some early data suggesting maybe the two of those together are better than one by themselves. And then also, focusing on men's health as well, and mental health, right? It's big to really focus on all of these things holistically because we know it's not just about a medication, it's about the whole package of treatment. And that's where this comes in, which is my 5 Ps. That's me lifting weights at my trainer at the training lab in Weston, Massachusetts. I like to give a big plug to Nicole because she is one of the reasons I'm in pretty good shape today, thanks to her. So big shout out to the training lab there. But I like these 5 Ps because it reminds me as a clinician of what to talk to people about, right? If it's on one hand, 5 things, right? And if you're thinking about, what do I want to work on in my lifestyle, right? For the health of it, right? It's planned portions, eating regularly throughout the day, planned portions, right? Controlling those portions and planning out, I'm going to eat this for breakfast a little bit, I'm going to have this for a snack, etc. plants and protein, right? The more we can eat plants and protein, whole foods, right? Not things so much in packages, but the more we can eat plants and protein. I mean, some of our protein comes in packages now, I realize that. But the more we can focus on that, vegetables, fruit, and 1 to 1.5 grams per kilogram of body weight of protein, right? And getting that protein with each serving. So if you're eating breakfast and you're saying, I remember Dr. Fitch said 5 Ps. Just say to yourself, am I having a plant? Am I having a protein? And if you're not having one of those, try to figure out a way to stick one of those in there, right? Throw a protein shake in there or throw some blueberries in there if you're just having a yogurt, right? To try to get those plants and protein. And then the third P stands for power, which is that focus on strength training. We all need to be working on strength training because there's good data to show that most people don't do it. Even getting up and doing 6 bodyweight squats every hour while you're here at work, while I'm sitting here at this chair, right? If I just get up and go up and down 6 times in my chair, 10 times, sorry, 10 times in my chair, and do that every hour as I am working during the day, that it was shown in a study, randomized study, to be more successful in terms of maintaining your muscle mass. Pillow stands for adequate sleep. It's very important. If we don't sleep adequately, we also don't maintain our weight adequately. We tend to gain weight when we don't sleep. And so again, that's a very way to focus. That's that baby there sleeping like a baby, right? The more we can focus on getting good sleep and good sleep hygiene, the better off we're going to be. And then pause stands for avoiding eating in the night. We really should have a break from our eating, mostly during the night. There's data to show it's not normal for us to eat in the night. So if people work night shift even, you should try not to eat during your night shift. Try to eat on the edges of your night shift, right? Before you go to work and when you come home, like you normally would if you were, awake during the day. Because again, it's not something that is necessarily good for us to be eating in the nighttime. And so ways that KnownWell can help. Again, we do this for the health of it, not the weight of it, right? We wouldn't want to focus on your whole health, which is why we have a team of health coaches, dietitians, clinicians that can prescribe medications, both GLP-1 medications, but also all the other medications, depending on your level of affordability and what you're looking for. We have meal replacement things that we can utilize, techniques we can utilize that have been used for a long time. And we have a RX Food artificial intelligence app that helps to create meal plans and helps you to track if you're wanting to spend more energy in terms of like finding out what kind of foods are good for you. Frequent visits to check in for accountability that are covered by your insurance with a copay. We take all insurance. We take Medicare, Medicaid. We're in 50 states virtually and 5 states right now, and soon to be even 6 states in the future. So right now we have clinics here in Boston, Massachusetts, clinic in New York City that just opened recently, a clinic in Atlanta, clinic in Dallas, 3 clinics in Chicago, and soon we're going to have a clinic out here in San Diego. I didn't update my map there. But then we have 50 state telehealth, so we can see you in any state in the country. And we're very excited about that. So our weight loss on average of our patients is around 15%, right? So all of our patients, no matter what they're doing, are able to lose at least 15% of their body weight. We have 50% less muscle loss versus the clinical trials, right? So our patients tend to lose less lean mass. That's because we're really focused on the other parts of it, right? Not just the medication piece, but also focused on that lifestyle intervention piece. 93% of our patients see sustained weight loss out to 2 years. And we're very proud that we have a 90 plus NPS, which means that we seem to be delivering on our promise to take care of you and for you to be known well. At least that's what we're focused on trying to do every day. So the KnownWell mobile app also helps to streamline care. We have a mobile app that helps you to be able to track your outcomes here, to also message people back and forth, message your care team more easily. And that is also something we have as well. And so some questions you can ask your KnownWell clinician is Foundayo right for me, right? Am I a good candidate based on my health history, my current medications, as we talked about? Do I have any history of medullary thyroid carcinoma or pancreatitis? Those are two contraindications in general to GLP-1 medications, right? That would make these medications unsuitable. how does the expected weight reduction compare to my goals, right? We talked about that a little bit. If your goal is to lose 40% of your body weight, then you're likely to need one of the very potent medications, and you may even not be able to achieve that with medication. That may be something you need to have surgery to attain, because again, getting into that greater than 20%, as you saw from the numbers, is very hard to do. Um, and then the other question you could ask is if I'm currently on an injectable, right? Does switching to the daily pill make sense for my lifestyle? Does it make sense for me? Does it make sense for how much weight I want to maintain, or do I want to, am I trying to lose more? And what does that transition plan look like? So it turns out we don't have to start you from the beginning, especially if you're on one of these medications. We can start you at the middle dose and then work you up accordingly. And then the other question patients ask a lot about is, managing side effects and costs. And, what side effects should you watch out for, and when should you message the office? That's what we cover when we meet with you. Will your insurance cover Foundayo? It's going to take a while for Foundayo to get on formularies. It doesn't go on immediately as soon as it gets approved. Some formularies take even 6 months to get medications onto formulary. So it may not be approved, but we can check that for you. We can check on that in our computer system to see if you have insurance approval. If not, I shared, the out-of-pocket cost, which is $299, for the most effective dose, which is what most people are going to need if they want to achieve, that greater than, 10 to 15% weight loss. So in summary, there are lots of choices for people these days, thankfully, but also I think, at KnownWell, we're very proud that we have a non-stigmatizing approach. We have an approach that focuses on the whole person. You can be cared for virtually or in person, at depending on where you're located. And we have a comprehensive care team to help you do that. We follow you up very regularly so that you're not feeling like you're lost and trying to manage this on your own. You shouldn't feel that way. You should feel like you have a supported group of people around you to help you accomplish your goals, and not just in the next 3 months or the next 6 months, but long term, which is why we felt so important that we take insurance, because we really felt like that was a way to help people long term if they could have, coverage for their visits, for example, covered by their insurance. And I think, our outcomes, we've published a white paper on our outcomes on our website, so knownwell.co. If you want to go to our website, that is where you can also register as a patient. I should really put that, in this last slide here. But www.knownwell.co is our website. You can register as a patient, you can book your first appointment, and you can be seen, virtually anywhere in the United States. You can be seen virtually even in the areas where we have a clinic, if that suits you better, from a standpoint of driving in, etc. We do have a body composition scale in our offices that looks at, how much of fat and how much muscle and how much water, how many organs, how much bone you have, right? So we look at all those compartments so we can monitor that over time, and we can monitor and make sure you're losing that body fat like you want to, and trying to keep the other stuff around. Last but not least, I like to put a plug in these to join our Peloton team. We have a group on Peloton, #KnownWell. So you join our KnownWell hashtag. I am BeWellMD. That is my call sign on the Peloton. And you can get the app, which has lots of good walks, especially this time of year outside. You can, obviously, I have a bike there. I like to bike. There's workouts on the treadmill. That's what I do when I travel. I like to use the treadmill workouts because I can get a little better workout. I mean, I can, usually have a treadmill at the hotel gym, whereas they might not have a Peloton bike, for me to get on. But encourage you, if you're on the Peloton platform, or if you haven't before, try it out. There's usually a free trial on the app. You can just get the app, like I said, and use your weights at home, on the living room floor. You don't need any special equipment if you don't have it. So thank you so much. I'm going to see, oh, there's our website, www.knownwell.co. I knew I had it in there somewhere. All right. Let me see if we have any questions. I see some questions here. I'm getting to them. There we go. All right. So I will stop sharing so I can see them a little better. All right. I have been on Mounjaro for 18 months. It's not doing anything anymore. Yes, that's very common. So with all these medications, you're going to plateau, right? There's going to be a plateau, a place where you come to. that you're going to reach this nadir. That just happens. It's not that the medicine's not working anymore. It's that the more weight you lose, your body creates more of these nutrient stimulating hormones on the other side to try to push your body back up, right? To try to push your weight back up. So the more weight you lose, the more power you often need to keep it down there, right? And the more power you would need in order to lose more, like you would need bariatric surgery or something else in order to get down further, something stronger, so to speak, than whatever you're taking. So everybody plateaus. And it's just that's what it is. And right now it turns out it's usually about 20%. At that 20% is where that it's very hard to get past 20% weight loss in biology, right? Human biology just doesn't like losing more than 20% of its weight. Now there's some newer medications coming into the market in the field that will produce 25, 30% weight loss on average more. So again, we're getting more and more medications in the future. But for now, that's not Foundayo. I mean, Foundayo is less effective than Zepbound overall, as you saw on the chart. So uh, this question was, would switching to a different medication like Foundayo allow me to get back to losing weight? No, we would not expect that to be the case. Because again, if you've plateaued on your medication, you're going to stay, like if you went on Foundayo after losing your weight on Mounjaro, you're likely to gain some weight back over time because the Foundayo is not quite as powerful, if you will, or strong of a medication as far as that goes. Um, this person did say, did the Manjaro build resistance? No, that's what I'm talking about, right? We get to this plateau because the body is trying to always get you to gain more weight back. It's like gain weight back all the time. It keeps doing that no matter how long you've had your weight off. I mean, there's a misconception that at some point it doesn't do that anymore. No, it wants to go back to that weight, even if that weight wasn't a healthy weight for you. It doesn't know that. We don't have this, we just have this thing in our bodies that says weight loss is bad. So don't do it, right? And the body fights back and tries to push that back up. All right. Will Foundayo be a better option for long-term maintenance versus injectable Mounjaro? Do we know if the Foundayo has the same level of anti-inflammatory action? So no, we don't, right? We know that the Foundayo does have anti-inflammatory action because we saw that in the clinical trial that they measured it. But we think it may be similar, to medications like Mounjaro, but again, if you're on one of the injections and you've lost a significant amount of weight, you've lost greater than 15% of your body weight, you're probably best staying on that injection if you don't want to risk gaining some weight back. So, that would not be a reason, to switch. Um, yeah, something they said adds up to more than 100%. That's probably because I could explain that, but that's because it's not supposed to add up to 100%. Like if you have this amount of people losing that amount of weight, it's those people are in that next category down as well, right? So that's the thing. No interactions with levothyroxine with Foundayo, at least. So you can take your levothyroxine. You should always take your levothyroxine and then fast for 30 to 60 minutes, depending on what your endocrinologist prefers. But there's no interaction like there is with the Wegovy pill. So you can take those kind of more together, if you will. If you have lost all the weight you need to and have been easily maintaining your weight loss for the past year on 5 milligrams of Zepbound with very minimal weight fluctuation and no food noise, will Foundayo be able to support you in the same way as the Zepbound? That's a great question. And that is really, again, I would suggest yes, probably at the 5 milligram dose, right? That you could switch if you wanted to and see how that goes. Of course, you can always go back on your other medication, So like if you go on Foundayo and it doesn't seem to be working for you, maybe it's the food noise that's coming back more. Maybe it's, again, because you could be more of a high responder to these medications, these GLP-1 drugs. We know there's some genetic predisposition as to why some people are high responders and other people are not. And so you may be able to maintain, if you were looking for a pill instead of an injection, or maybe it's a cost thing too. Although the 5 milligrams of the Zepbound is, it's still more costly than the Foundayo. So you would save some money there if you're having to pay cash. Um, So how is this viewed as a maintenance drug compared to Zepbound? Well, I think I kind of answered that in that this is ideally a maintenance drug because in the Attain Maintain trial, most people were able to maintain their weight loss. Although there was some weight regain, it depends on how you define maintain, right? Maintenance, you have to look at trials and make sure because a lot of times maintenance is is defined as within a 10% regain, right? So again, you have to be okay with that as a patient that the weight's not your primary, thing that you're really focused on. You have to have other reasons, right, for going on that medication. But yes, I think this would be it's also a nice medication to start on, right? Because again, it gets that 11% on average. Some patients, 20% of people are able to get into the 20% weight loss category. So if you're one of those 20%, you don't care. If you want to lose 20% of your weight and you're one of the 20% on Foundayo, then you're good, right? If you're not, then you can go up to one of the other medications that may be more effective. For example, go on to Zepbound in order to try to, if you're not one of those people that's getting the 20% weight loss that you might want or need, on the Foundayo. So that's another approach, right? From a cost standpoint. I'm going to try to see how much I can lose on the Foundayo. If I'm not one of the high responders, because I'm trying to get 20% weight loss, then I'm going to jump over and go on the Zepbound. So that there's definitely the ability to do that. All right. Are the side effects more similar to tirzepatide versus semaglutide? Well, we don't really know because there's not like a head-to-head trial of the two. Those numbers I posted on side effects were all just from the individual trials. But as you could tell, they were pretty much the same, right? So the numbers are pretty much equal. So we have very similar side effects among these medications, and one just has to try it and see if they like it. All right. So this person said, have read that oral pills absorb via the gut and can be interfered with by some patients' microbiome. Um, I don't know that we have that data on this medication. I've never really seen that data in a randomized controlled trial fashion. But we do know absorption plays a role, right? So we don't know why some people might be better absorbers either. So that is one of the downsides of oral medication is that absorption piece. And I would just say that as it relates to people who've had surgery, if you've had weight loss surgery already and you're looking to start one of these medications, you're probably best to go on an injection still, just because if you don't mind, and depending on the cost, if you're going to go on a pill, I would definitely choose Foundayo over Wegovy pill because Wegovy pill does need an intact stomach in order to, like a not surgery stomach, right? In order to absorb properly. So I wouldn't want people to be on Wegovy, not because it's going to hurt you, but just because you're not going to get it benefits, you're not going to get effects, and then you're going to be wasting your money, especially if you're having to pay yourself. So with the Wegovy pill, we definitely, at this point, until we get more data, would not recommend using it with patients who've had surgery. While I would probably try Foundayo if people wanted to try Foundayo, because again, it doesn't need that sort of exact stomach issue in place. This is a good question. Oh, Zach is here. Hello, Zach. Is the FDA's recent request for liver data of concern given the number of patients with MASH or MASL? So, good question. So, the FDA announced that they wanted to make sure there's been some early research with some of these small molecule GLP-1 type drugs that shows that people might get a bump in their liver enzymes or that the drug itself might be affecting their liver. And again, so the FDA has asked for more data over time as the drug gets out there more. So it is something to be mindful of, right? And that's again very similar to the interaction with simvastatin. We want to make sure that people aren't on some of these other drugs that activate that cytochrome system, and we want to be mindful of that, which is why it is important to recognize that. I don't think it plays a huge role necessarily with MASH or MASLD in particular. I think it's probably just dependent on certain people that may have that response, and that's why we're going to need more data to look at that for sure. Okay. Yes, we will be posting the talk along with the others on the website. So again, we will be posting this talk on our website so that you can go back to it or you can refer other people to it if you like. And one more minute. Yes, you would need to reach out to your insurance company to find out if Foundayo is on the formulary. You can do that. You can call your insurance. It's probably the sort of, most effective way to do it is to call that insurance company and see if they've had it on yet. And that's another, thing to look at. Um, okay. I got lots of questions. Thank you guys for being so engaged. Why is it the 1 month transition between stages? Is it possible to shorten it if you've been on an injectable? So that's a good, like I said, if you're on the medication, if you're on Wegovy or Zepbound right now, and you're going to switch over, if you're still taking the drug, we will switch you over to a middle dose and then ramp you up. So you don't have to start from scratch from baby doses. But if you've been off of your medication for a long time, you really do have to start at the beginning. And that's really just to minimize the side effects. And the 4 weeks is just, I think, a a good time period to put 30 pills in a in a bottle. And so again, and it's also based on data to show it takes that long to get into your system, right? I shouldn't make it so trivial, meaning these drugs have a longer half-life. And so again, it takes longer to get them up to steady state in your system. It takes that 4 weeks before you're reaching that true drug level in your body. So you really don't know if you went up too quickly, you might then have more side effects and then you're feeling poorly and we don't want that, right? So it's really about managing that half-life of the drug and managing that dose titration to minimize side effects and get you to where you want to be long term. All right. This is a good question. Real quick, last one. I know we're over by a minute. If you need to go, you just jump right off. Since you're taking it daily, does it have more consistent control over hunger? So that's a good question. We don't know. That's a good thing. This is one thing that we think might be the case for people, or might be a reason why we might prescribe a daily medication. So, some people notice when they take their medications, their weekly injections, you get that really big suppression of your hunger the first couple days, and then by the end, by your time you're taking it again, you might be getting, more of your food noise and other symptoms back. So maybe it will be. So that's a good question. That's a good question to end on. And thank you so much, everybody, for being here. Again, apologies for changing the time, and hopefully those people that were counting on it at 6 right now are able to watch the video instead. So apologies for that, and thank you all for sticking around, and great to see you. Be well.